So, big welcome to Ilan Kelman and to Nina. So fantastic. Thank you so much for joining us. So, just before I ask you to introduce yourselves, Ilan, you very kindly joined us at our previous webinar. So the last webinar was on the 15th of January when we talked about what we want from COP26. So, Ilan, you so impressed everybody that we had to invite you to come back to say much more. So, over to you, Ilan.
The stage is yours. Whoever speaks will be right on stage. So we're very much looking forward to hearing you talk.
Well, you're very kind, and certainly given the beginning with Annie, which was absolutely wonderful, it's going to not be easy to top that, but nor do we necessarily want to. This isn't really a competition, and we're all in this together, so it's wonderful to have you all here. I'm Ilan. I'm at University College London in the UK, and also the University of Agder in southern Norway, where I'm in two institutes, so the Institute for Risk and Disaster Reduction and the Institute for Global Health, trying to bring together topics of health and disasters. And delighted also that Nina can join us.
Yeah, I'm really excited to be here. Thank you so much for having me. So my name's Nina. I'm a final year medical student at the University of East Anglia and a research assistant and postgraduate at the Institute for Global Health at the University College London.
Nina, can we have some more detail on that? Where would you like to end up?
Oh, that is a long answer. Which I think might even take up the slot that we have. Undecided.
Okay.
But definitely somehow incorporating what we're going to talk about today, which is kind of how I ended up here.
Brilliant.
But please go ahead, Nina. Start us off.
Great. Yes, thank you. So my first question to you, Ilan, is you kind of within your work you talk a lot about climate change action and disaster risk reduction. So my first question is, what does it mean to actually place climate change action within other sustainable actions? What does that look like practically?
Yeah, to me actually this sort of encapsulates a lot of what Charles and the others are trying to do and really why we're here, coming together. So we see so many phrases out there: sustainable development, climate change adaptation, disaster risk reduction. To understand what they mean, it really is a lot of explanation and reading. But distilled, they really tend to be the same sorts of things. So we do need to stop climate change. We know we are causing it. We know it is problematic and we need to stop it. But what that means is really stopping emissions or increasing their absorption, which is exactly what we've been doing for many other pollutants. You know, recently, like for the ozone layer and the substances harming that, but also for acid rain, and long before that in terms of lakes dying, harmful chemicals in the environment. So it really is simply about preventing pollution. And stopping climate change sits very nicely as a subset within this wider context of let's stop pumping out stuff which is harmful into the environment. Since simultaneously and overlapping, we know that climate change is happening because of us. We are seeing the impacts through increased intensity of storms, although actually interestingly hurricanes are decreasing in number. There is less frequency of hurricanes due to climate change, but when one forms, it's far more powerful, far stronger. So we do have to deal with these issues. But we've always dealt with droughts. We've always dealt with heat, cold, weather, hurricanes, cyclones. So this is what's dealing with disasters. And there is nothing in climate change adaptation, dealing with the impacts, that is different from what we need to be doing anyway. So I just say, yeah, we do have to adapt to climate change, but it's the same as dealing with disasters. So let's connect everything rather than saying, okay, you do climate change and you do disasters and you do pollution and you deal with greenhouse gases. No, it doesn't make sense. We're in this together for the same goals. Let's join forces and do everything simultaneously.
Thank you. Yeah, I think I've certainly seen that as well with kind of the disconnect between air pollution and, at least from kind of the health perspective, the effect of air pollution on number of respiratory and cardiovascular diseases, but then that's somehow disconnected from climate change and climate change action.
Well, why do you highlight air pollution so much?
Well, I guess that's been one thing that has certainly in the UK, particularly in London and big cities, been quite an issue, something that's come up a lot in the media. I mean, sadly, with Ella Kissy-Debra's death related to an asthma attack in 2013, that was really highlighted because it was the first time that air pollution was noted as a cause of death on a coroner's report. So I think kind of these types of stories are really similar to what Annie was talking about, shifting away from like fear-based narratives and more story-based narratives about actual people experiencing the effects of climate change. I think that's what's starting to come through more and more, at least in my field.
So for me, Ilan, what you talk about with really everything coming together, I mean, for me, this really resonated with what you said before, and since you spoke before, I've come up with some great examples also where this is important. So Linda Meehan, who's coming on at the end at 9 o'clock, she'll be on the same panel as yourself. She's got situations with local authorities where they're looking at making complicated decisions about situations where everything's got to be brought together. The UK, of course, is now rethinking this idea of having a coal mine in Cumbria. So this is a great example where there was different thinking going on in different departments, and this now all needs to be brought together. But one of the best examples was someone I met on the internet was talking about this site called Carrington Moss near Manchester. And you can see that this was a site that someone had on the planning slate for sort of 20 years, eventually trying to get built on this area. But the fact is it's a peat moss. And so the issues of it being a great site because it's an expensive location nearby, it's a great place to build in terms of house prices, but there's no public transport there, and it's on a peat moss, which is going to release huge amounts of CO2 emissions. And all of those factors, I believe, really need to be brought together in order to look at what is a proper decision for dealing with this. And if you look at just one or two of those factors instead of all those factors. So I think this is, for me, a really, really practical example where I was able to take what you said last time and bring it to a real example. And I hope that decision makers across the world are following the lead that you're setting here, Ilan, to really review all of these things that have been done in the past, bring everybody together which are relevant to new decisions, so that the best information and advice can be brought together to any given situation. So back over to you, Nina.
Thank you. So you were speaking about disaster risk reduction, the pollution prevention. I'm wondering, what's the role for kind of wider kind of sustainable development goals and that type of thing?
Yeah, I mean, you're absolutely right. And I think Charles' example really brings this forward, that it's not about stopping with disasters or pollution, but thinking even beyond that. So sure, so we make a school or hospital which is good for climate change in terms of being energy efficient and not falling down in weather. It doesn't help if there's, say, asbestos problems or if it collapses in an earthquake. But then we say, okay, well, fine, then the school and hospital can deal with everything from the environment and has no pollutants. But it doesn't help if, say, it's in a place where girls cannot attend, or in a place where you have to pay for any hospital admissions. So this gets to these wider connections with equity, with justice, with stopping oppression and marginalization, and talking about these wider, this sustainability, long-term sustainability and development. It also sort of comes to a very good comment which we had in the chat, that what about things which climate change brings which are apparently new? And the two examples given are heat and sea level rise. When it comes to heat, that is actually a huge concern, but it's not just heat, it's heat-humidity combinations over time. So we have to be very wary that when climate change does push certain places into realms where you cannot survive outdoors because of heat, humidity, time combinations, there's actually not a lot that we can do. 24/7 cooling takes a lot of energy, and people have to be outdoor for food production and to get water. So absolutely, heat, humidity, time is a major issue. With regards to sea level rise, if we take out the ice sheets, the Antarctic and Greenland ice sheets collapsing, if we do not worry about that, I'll get to that later, then actually sea level is not going to rise extensively, and certainly not more than it has been in the past 10,000 years. So the issues we've built on coastlines, we've made it very vulnerable in our cities on coastlines, which means it's really us rather than sea level per se. If the ice sheets go, then that is very problematic. Then we're talking about major coastline realignments, and again, that is huge, and it's something to consider. We have 80 to 100 years to prepare for that if it's going to happen, so we better start now. And again, so much of that is up to us. Within this, though, I've kind of dodged sort of your expertise, Nina, in terms of being health. I said, well, sustainability and development and disasters and climate change. But what about health? I mean, should we put health above everything? Should that be our focus? Where does health sit within all this?
Well, I guess from my perspective, I kind of came into this issue mainly under the newfound understanding that the climate crisis is also a health crisis, it's a public health crisis. We were talking about air pollution earlier. Just last Tuesday, the Harvard report came out that over 8 million deaths, that's almost 1 in 5 deaths in the world, are related to air pollution. And those are all preventable deaths kind of from my public health perspective. So I think understanding that the climate crisis is a health crisis is something that has helped mobilize a lot of healthcare professionals to speak up about this issue and also take action. Because primarily, we take the oath to do no harm. So I think that's really powerful. And what you said about kind of keeping health at the center of climate change adaptation helps ensure that we don't exacerbate health inequalities by, for example, building these sustainable buildings, but then within them, people have to face high user fees and high out-of-pocket expenditures. So I think absolutely health should be kind of incorporated into the center of both action and then adaptation, because as Annie said with her kind of fear-based versus story-based narrative, I really like that, because I think understanding it as not just some far away like ecological crisis, but more of a health problem that affects each and every one of us, I think is quite important.
I mean, that's so interesting, because Charles and Annie and Gary were talking earlier about sort of the COP coming up, the Conference of Parties, which is an almost annual meeting for climate change, but we don't have a COP for health. Mm-hmm. There are COPs for other issues. So, and there's also the phrase which you just used, sort of climate crisis, or though thinking about the difference between, say, climate and climate change. So is it the changing climate, the crisis? These are sort of issues. And then there's so you mentioned the wider aspect in terms of a health crisis. But we don't often speak about the disaster crisis, because like disaster and crisis are to some extent synonyms. Mm-hmm. So what do you advise, Nina? Should we start out by saying, no, this is a health crisis of which climate change sits in there and we need to work together? Should we start out saying it's a climate crisis and that impacts our health? If we're dealing at the international level, should we go for a health COP? And at the individual level, should we talk to people about their health or talk to people about climate change?
I think that's such a good question, and something that a lot of people are kind of trying to figure out how the best way is to frame climate change and from what perspective to kind of tackle it. I wonder if it was so clear to everyone the health impacts of climate change, these just from air pollution, what I mentioned earlier, those 8 million deaths per year. I mean, if you compare that to even just, like, sadly, the COVID deaths that we've been experiencing, those numbers are so baffling to me, 8 million deaths. So I think, and preventable deaths as well, is kind of the problem with a lot of climate change related deaths, is that there's this feeling, at least from the kind of healthcare professional role, I think that there could have been something that we could have done about it. So I think it's quite a powerful way to bring across that message, and to also get kind of a whole other section of people involved in these conversations as well, that it's not just kind of an ecological problem.
I mean, the messaging is so important, and also I'd like to sort of bounce off from what Annie made very powerfully, is that a single message does not reach everyone. It's not one size fits all, so we have to think about different ways of approaching it. And for anyone with asthma or chronic respiratory difficulties, air pollution is just huge. And again, as heat increases and humidity increases, it's simply going to get worse. Plus, we have to continue to reduce emissions. But there's also sort of the other aspects which are also targeted messaging, such as people say, well, at least eat less red meat. Not necessarily meat overall, but definitely less red meat, which is very good for health, and also means that our emissions reduce. It's then a challenge that if we switch from, say, even all meat and say become vegetarian, and so we switch to tofu, we have to look at the full life cycle, not just greenhouse gas emissions, but also all other pollutants which goes into producing food. And if people are cutting down, say, rainforest far away to grow soy for tofu, is that really necessarily any better than raising a lamb yourself or raising a cow yourself, treating it well and then slaughtering it and cooking it? Not that I personally would kill an animal. I don't find that easy, and I've been vegetarian for a long time. But I'm also conscious that fruit and vegetables sometimes come a long way. And so it's about the whole life cycle. And similarly, if we were able to get a lot more vehicles off the road, particularly in London, then it would be much safer for cycling, and more people would do it. And it's the same with Toronto, actually. There's a lot of very similar issues between Toronto and London in terms of planning for regional transportation and trying to ensure that people feel comfortable and safe, not in their private vehicles. And now with COVID, people have a good reason for actually wanting to stay off public transport and being in their private vehicles. So this is where perhaps some people respond more to climate change, some people respond more to health. And we have to think, well, how do we get the messages from individuals, as we're doing here, but also right up to those UN levels, those international levels? And as a medic, soon to be doctor, I mean, what would you do, Nina, to get to the World Health Organization, to get to UN climate change? Are you going to COP? Have you been to a COP? How do you present yourself and actually connect health, climate change, disasters, pollution in those contexts?
So your first question about COP, personally, I'm not planning on going to COP, more out of a lack of kind of access to it really than anything else. I know that there are some with Students for Global Health, which is an organization that works kind of closely with the International Federation of Medical Students Association, and I know that there are some representatives going from those groups. So there are, I think, increasingly people going who kind of are coming from the health perspective, and I think that more people should go to those types of things and make sure that narrative and that is also heard in these spaces. But I don't know, I'd be interested to hear what you think about COP, because I heard Scarlett Westbrook, she's an amazing youth climate activist, speak a couple of weeks back, and she said something that, well, first of all, COP has been around longer than both of us have been alive, and secondly, that if COPs work, we wouldn't have our 26th one coming up. So I'd be really interested to hear what you think about, you've been, seeing these every year, and I'd be interested to hear what you think about their role in all of this, how we can make it more effective, and also what you're kind of expecting from the one coming up.
Okay, well, if I can just come in there, guys, we've got a couple of the subject is really what's possible. So if in answering that, if in the last few minutes we can just come together on, from your area, the two of you, really climate and humanity, what's possible, and what's possible in particular by 2030. So if we could sort of move to some conclusions and ideas, and obviously we can then pick those up again in the conclusion. But back over to you, Ilan.
Yeah, absolutely. I mean, I think what's possible by 2030 is really what we set out to achieve. And if as individuals, we choose how we are going to make a difference by making small changes and medium changes and larger changes, together we will be able to achieve so much by 2030, which then comes back to Nina's question, irrespective of the cost. The real challenge is so much energy and effort going into these international meetings, which are understandably a very slow process, and because of who is in charge and how they're run, they are actually a very ineffective process. So for me, never having been to a COP, I've preferred to send Indigenous peoples when it was possible using some of our projects, but also say, no, really, what can I do? What should I be doing for myself to reduce my entire life cycle burden on the planet by basically reducing consumption overall, and trying to make better selections, and recognizing that, yeah, we've been in this for a long time. There have been so many of these international meetings that as individuals with such a short time frame of 9 years, how can I continue to reduce consumption? How can I continue to support others in doing that? And say that for me, then it becomes healthier lifestyle, because I am doing better with transportation, I am doing better with food, I am doing better with where I get my energy, where I get my water, and hopefully also learning, meeting wonderful people like we have on this call, and saying within 9 years, how can I just continue to push myself and those around me to do so much better for climate change, but within wider context, in terms of living healthier, more sustainable, and safer lives, away from pollution, away from disasters, and helping others achieve those goals. So I'm very privileged. I can start with myself, not everyone can do that, and simultaneously try to set up mechanisms, ideas, and processes where others have more opportunities and choices to try and do even better than me in the 9 years that we have remaining.
But what about yourself, Nina?
What was that, sorry?
Well, what about yourself in terms of the answer to that question for 2030 and what's possible by 2030 in your view?
Well, I think the next 9 years are certainly going to be very important for bringing about change. We had the last kind of talks about changing governments, which hopefully will help contribute to that. But I think at least in terms of the kind of health indicators that we've been tracking, each year it's getting worse and worse and worse. And I think there's more and more kind of talk around these issues. So I'm really hoping that, especially post-COVID, we've seen how important it is to invest from kind of a public health area. So I think understanding that climate change is just going to increase and is increasing the risk of vector-borne diseases and future pandemics. I think that makes it so much more real, and I'm hoping that will also bring about a lot more change.
Super. What I'd just like to put on the table is that I started off with climate change looking at the top level, which was I was working with a group Saving Our Planet, and Stefan's coming on from that group shortly. Working with that group, looking at the international perspective, I now see all these different layers. So since then, I've looked at done some work at the local authority level, and even on the last panel, we're going to have with us Donna Simpson, who's from a local authority. So you've got the international level, the national government level, local authority level, big business, small business, individuals. And for me, the way the climate change, global warming world looks from each of those perspectives is different. And for me, the way to make it really, really effective is to work at each one of those levels individually, because at the top level, it may seem a great idea, but at the level of the community, the local authority, the individuals, there has to be a grassroots buy-in. There has to be an organisation which is driving it in order to make it happen. And the things should be brought together by government level communications. I mean, in this area, Nina, what's been done with COVID, I mean, the government has made an effort with COVID communications around what you're supposed to do. In climate change, they've made some policy moves that, to my mind, they haven't really communicated to people why they need to do all this stuff. So with COVID, we've got clear messages: wash your hands, social distancing, etc. At least that's clear. On climate, we haven't got that yet. So that's my thinking, that it's so important that at each one of these levels, each one of these groups, action is proposed which is appropriate to all those groups, including absolutely, Ilan, as you mentioned, individuals, what they do, and for example, whether they have a less meat diet. So back over to you, Ilan, if I may.
Yeah, and I think we also have to be thoughtful about the messages and really try and determine, are they working or are they not? So on COVID, in the UK, they've used exactly the phrase which you mentioned, social distancing. To me, physical distancing is the issue, because it's staying physically apart from each other while still trying to be as social as possible. We actually don't want to be socially distant. So that was one big error, which certainly the UK government made. Canada has done a bit better regarding that, but social distancing is taken off rather than the reality of physical distancing. Similarly, the government for a long time had its message as being face, hands, space. Cover your face, wash your hands, give space. It's actually the reverse. If you stay away from people as much as you can or stay indoors, and then wash your hands, then covering your face is actually less important. So it's the same with climate change. People often give inappropriate, contradictory, and actually counterproductive messages, but some of them are effective. So this is where we really need to know who are the different audiences and what do they respond to. And injecting hope, injecting optimism. There are so many wonderful examples of successes for climate change and for beyond. So we do need to tell more of these stories. And as Annie was saying, try and avoid too much fear, go for hope, but also be realistic. And I think what Nina said regarding disease, for example, is one big area where we do have to be very cautious and recognize the importance of what's going to happen with disease under climate change. So this is where the health professionals may come with a more fearful message, but also I'm sure Nina has plenty to offer in terms of what we can and should do to ensure we have healthy and safer lives with climate change and beyond.
So Ian, you're absolutely wonderful with these messages. I mean, I was not expecting to be hearing that face, hands and space is the wrong way around. It should be space, hands and face. So it just shows, Ilan, we'll have to have you back yet again to talk about more. So we're getting towards the end now. Nina, do you want to ask one more question before we have to move on?
Yeah, the only other question that I wanted to ask about was so the descriptive review on the economics of biodiversity recently came out. I was wondering, so in the next 9 years, what is the role of what was talked about in this report, specifically kind of inclusive wealth? How does that fit in with the bigger picture?
Yeah, it was wonderful to see two key messages from that report, which have been around for decades. And we need these at the higher levels. Number one, we have to consider nature. And no kidding, in all the calculations, not just economic. I mean, why are we even highlighting economic calculations? But nature is important and it's actually part of us. So that was very exciting to see. Number two, GDP, gross domestic product, is an absolutely terrible measure. We should not be using it. It is a very poor indicator. So I think it comes out of, we need to focus more on these other aspects like health, like sustainability. And so when a high-level 606-page report comes out with these two powerful points, grab it, move forward, and really push those ideas.
Thanks, Nina. Thanks for putting that on the table. That's an amazing report, and Ian's gone straight to the heart of a couple of really, really important areas that highlights. So, Gary, are we timed out?
I could listen to the